Hello, Anna. How are you?
Well, how are you?
I'm well. It's so good to be here with you.
Likewise.
I I like threw us into the folds and it was not my intent. I'm sorry. I just threw us right in. Listen, Anna and I were having a sidebar conversation and I hit go live by mistake, like, and it just did it. And so my bad. But you were sharing something with me. So I'm gonna introduce Anna in a minute, but she was sharing with me that if you
Uh,
want to share it.
sure. Actually, yesterday, was my sister Bobby's birthday. We were pregnant at the same time. She had four children, and I was pregnant with my first. And she actually passed away in postpartum. So she's one of the reasons why I started Mom Care. So I
Wow.
dedicate my interview and the time I'm sharing with you to her today.
Wow. Oh, happy birthday, Bobby, my Aries sister.
Yes.
So
Fire.
my birthday is next week.
Yep.
So
Yep.
yes, so wow, wow. Happy birthday, Bobby. We dedicate this to you. So listen, y'all, we jumping right in, clearly. We are getting right to the heart of it. Um, Hello, everyone. I'm Nakeia Drummond. I am founder of The Well and founding executive director of She's Well Networked. And our work is really about supporting Black women in all things business ownership. So, supporting our mental, our physical, our financial, our social, emotional, our psychological, supporting our needs as we journey through this world, crazy, crazy world of entrepreneurship together and build legacies for our families, our communities, and beyond. And so I'm always honored when I have an opportunity to speak with one of our members, one of the amazing women who decided to bring all her good stuff, her energy, her joy, her struggles, her triumphs, her questions about business ownership and just navigating life with this as a mantle that we carry. I'm always honored when those women, one, join this space with us, but then two, give me time to talk to them on platforms like this, our Well Women Wednesday conversation. And so these Well Women Wednesday conversations are always so focused and dedicated on like me being all up in all your things businessy. But today is a really, really special one. This week is Black Maternal Health Week, and that's why we jumped right in and Anna shared that she's dedicating this conversation to her sister Bobby, whose birthday is this week and who passed away um, due to postpartum challenges. And yeah, like motherhood and pregnancy and the whole journey to become a mother is so challenging and so miraculous and so fragile. And, because there are so many people here, I guess, and it happens, we really underscore and undermine the fragility of that process and the number of things that have to go so right for any of us to be here. It is truly a miracle that any of us are here, period. But this conversation is really focused on Black women because our outcomes look so starkly different from other women, other mothers who bring life into this world. And yeah, so I'm excited to have an opportunity to talk to you, Anna. Anna is a practicing doula, and I'm going to read her bio because I want to get all the things. She's a practicing doula for 15 years. Is it more than that now? Because I don't
It's
know if
right.
16, a yoga instructor, an energy healer, and you will know that if you are in honest space, she truly is an energy healer, and a wellness practitioner based in Baltimore City. She's executive director and founder of Mom Cares and the Rising Mama, a wellness organization that centers mothers in the delivery of care and support to the entire family. That's beautiful. Thank you. That's beautiful. Anna is the chair of the Baltimore City Maternal Mortality Review Board, as well. Thank you, as well as a member of the Fetal Infant Mortality Review Board, Bee City Alliance, and Maryland Breastfeeding Association. She's like on all the things, and she's making sure that we get this right for Black mothers. Among many other awards, I'm not going to read them all, but among many of her awards and accolades, she was named Baltimore Homecoming Hero in 2019 and the Game Changer by Baltimore Magazine in 2021, because she is that, she is her. And most importantly, Anna is the mother of two sons, Aiden and Asher Rodney. And so we share, our sons share a name. I'm a mother of an Asher as well. And I'm so excited to have this conversation with you because we do share so many of those similarities, and always your energy is so amazing. And I've got my own stories, right, too, about my experience and with the healthcare system and during pregnancy, and after losing a baby, and even the process of losing a baby. And but what I say today, as we talk about, even your sister passing, I'm grateful to be here to tell this story, because the reality is that the maternal mortality rate for Black women is un it's unreal. It's two what I The data I read was in 2023, no, 2021, it was 2.6 times the rate of white women,
Mm.
with the same, all other things the same.
Not even. So they say that the quote is that a Black woman with a doctorate uh,
Hmm.
more likely to die than a white woman with a GED. So we know
Wow.
do all the things. You can go get all the money,
Mm.
degrees, you could be married, you can have all these things, and those still aren't protective factors to keep you alive during pregnancy, unfortunately. Um, and it's heartbreaking.
It
And
is
that,
heartbreaking. So, and before we continue this conversation, just in honor of all the Black mothers who have lost their lives, bringing life into this world, and everything, all the life that they gave to this world before they were taken away, because of things that could have been prevented had people listened to them, had people checked, and really looked into what their issue was. I just want to, just give a pause to that. Just give pause. And I honor their sacrifice, but no more. Like, we really, really, there's so much work to be done. And so thank you for doing that really critical and crucial work, and work that I know takes so much of you emotionally
mm,
every day. It has, I mean, there's no way for that work not to. And especially, you started with the story of Bobby, your sister, and that really brought you into this space. So yeah, tell us a little more of like how you came into the work and built a business, an organization in this space. Like, what's your story around that? What did you bring with you?
absolutely. So I've been a doula for 16, going on 17 years. My oldest doula baby is going to be 17 in the fall.
Oh,
So crazy. And I started in college. I mean, I was not in college 17 years ago. But I started
none
in
of us were.
that I started in college. A girlfriend of mine, she got pregnant. It wasn't planned. She called me and was like, "Hey, this is what's going on." And I said, "Whatever you want to do, I'm here to support you." And she wound up um, going through with her pregnancy, and I was there, and I was just like, when the baby came out, I was just like, that was the most disgusting, amazing, spiritual, wonderful, scary. Like, it was everything at the same time. And I was just like,
Yeah.
I want to do that. Um,
Wow.
and so I started there. It wasn't until 2014 when I got pregnant myself.
Hmm.
It was really hard. um, my pregnancy was unplanned. I was always the golden child. I did everything right. I did everything the way it was supposed to go. And then here I am, lonely pregnancy. And then I was overweight. I was stressed out. I lost my living arrangements.
Mm,
I was being
mm,
hit by folks in my community. It was just really stressful and hard. And
wow.
um, it affected my pregnancy.
Mm,
So my son was born 3 months early. And again,
mm,
my thing was like, well, I'm a doula. I got this. The community is going to show up and show out. And unfortunately, in 2014, we weren't talking about these
yep.
morbidities or the mortality as we are now. And so
Yep.
nobody really knew what to do. Nobody really knew what to say to me. I was angry. I was hurt. I was traumatized.
Mhm.
Not a pleasant person to be around.
Yeah.
And so I spent 6 months in the hospital with my son. I had 3 near-death experiences of my own, and
Wow.
I saw my son come on and off again and back on, oxygen support. We actually came home on oxygen support. Um, I took a moment when we got home just to get to know him outside of all the beeping and all of the doctors and things. And then I was just like, "We gotta do something, like, this has to this" that was intense, like, other people
Yeah.
are going through this. And so
Yeah.
I started with, like, a group, and just getting, moms together, and then, my sister passed away, and then I was just like, "This is not normal, what is
Yeah.
happening?"
Yeah.
And that's when I really sat down and wrote out the entire what Mom Cares was gonna be, and now Mom
Mm.
grown far beyond my wildest dreams or imaginings. But it was the year after my sister passed away, I got my first grant funding. I got everything kind of happened. And so
Yeah.
I'm spiritual and I believe that I wish my sister was here. I really do with my whole heart. But I believe that when she did transition, she was pushing and cheerleading me on the other side because things really
Absolutely.
after she passed away.
Yeah.
So
It's interesting as you were talking and I was sitting there like, "Oh, Bobby is working it out over there," so it was before he even said it, like, she is definitely, um, doing this work with you,
yeah, for
doing
sure.
this work with you, so that's beautiful. Um, yeah, I have a very like my own like very traumatic story. And I won't get into all the details of it, but my first pregnancy was in 2013, 2012, when we were supposed to deliver in 2013. And um, I spent 2 hours in a emergency room as telling people I'm in labor and I need help,
Mm,
and before anybody did anything, and it was too late. And so my first son, Brooks, did not get to be on this side of earth, but I believe God sent him back to me in the form of Asher the next year. And even in that pregnancy, I had to be on bed rest. I had to have, sort of supply. And I remember going to the hospital one day, and this was in 2014, 13 through 14. And I remember going to the hospital one day because a procedure I'd had where I had to have anesthesia. The anesthesiologist must have hit a nerve or something because I'm like having like muscle spasms. And I'm like, I'm in pain, I'm in pain. And the nurse says to me something along the line of, that procedure is not like a painful procedure. Like you must have a low pain tolerance or something along those lines. And like that stuck with my husband like for years. It took another doctor for something else telling him like, no, she's like tough, like, like whatever, which it shouldn't even matter. Like if I'm in pain, I'm in pain, right? But we to your point, we were not having these conversations about how we were treated in those spaces and how to advocate and all of that stuff. We were not having those conversations. And so you just kind of take it on, you take it in, and it's something about you or whatever. And it's not that the system is like not serving you and not doing what it needs to do. And even another time I went to the hospital, because listen, after you you lose a child traumatically, any little thing, you like, oh, we're going to the hospital. So another time I went and they were like, I'm having like cramps or whatever. And they're like, oh, you must be dehydrated. I'm like, there's no way. I'm on bed rest, so I don't do anything. And I drink like 7 bottles of water a day. Like I'm literally lining them up. I see them. I'm not dehydrated. And it took someone in an alternative medical space. So my acupuncturist, who's also an herbalist, to say like, actually, I think it's the opposite. I think you're washing out your electrolytes, and that's why you're cramping. Like, and so there are these people just aren't listening, right? And so they put me on an IV and they're flushing me with more stuff, like because you just must be dehydrated, despite what I told them. And so, yeah, when I hear these stories, I know because I know, right? Like, because I've been through it, because I've experienced it myself in a number of ways. And so, why is that? Why, like, what are the factors that are leading to these outcomes for Black women?
Racism. I mean, I wish, we could talk about the social determinants of health. We could talk about access to healthcare, and in some cases, those things do influence, right? But the numbers that we are seeing, the way that we are seeing those numbers, is because of institutionalized racism. Because doctors overwhelmingly believe that Black women have thicker skin or have a higher pain tolerance, or and so there's the idea of like, if I'm too loud, then I'm medication seeking or I'm being dramatic. But if I'm too
Mhm,
quiet and I'm saying the same thing, then I don't. There's so many intricacies that are stacked against us, right? And I want to say that pregnancy is supposed to be joyful.
mhm,
So many joys that I was able to experience in pregnancy, and I think Black women, period, we deserve that, and it's a beautiful
mhm,
experience. And I don't want people to walk away from our conversation and feel like, oh man, maybe I shouldn't have a baby. Like, no,
mhm,
more brown babies, more Black babies out here. Keep having babies. But
mhm,
unfortunately, um, the way that the system is set up historically is not for us.
mhm,
The way that the medical books are written, the way that the curriculum is written, the way that the older staff that's training the younger staff, they're set up, right? Like, if I come in with my Black skin to a appointment, someone's going to hand me a pamphlet about WIC. They're not going to ask
mhm.
income, not gonna ask me, and there's nothing wrong with WIC, right?
Yep,
Like,
yep,
there's an assumption just based on my skin, and there are a number of assumptions about that, right? And so, if I have a powerful personality, which I do, I can't turn it off. I can't put it on mute, right?
yep.
But if I walk in with my powerful personality and I'm saying, "Hey, I'm in pain," it's like, "Oh, well, you don't seem like you're in pain. You seem very, together." Well, I'm telling you that I'm in pain, right?
Right,
Like,
right,
if I can, I'm sorry that I can articulate where it is and how it is, and I can be relatively calm, but like, that's what it is. Because if I come
right,
screaming, it's like, "Oh, you're being dramatic." And what I tell
right.
clients all the time is, "You've been with your body the longest. You
Yeah,
what's going on with your body. You know
yep.
when something's wrong. You know when something is off, right?" And so part of our job is to work with the medical professionals who now are understanding it, who are now getting it, who, there's legislation that says that you have to have, this training, to say, hey, like, what does it look like to treat this person as if they're your sister or your cousin or your mom
Mhm,
or your wife,
mhm,
right?
mhm.
Um, and kind of take those glasses off. But because institutionalized racism is so pervasive, it's in the practices. You don't even know that you're doing it sometimes. Implicit
Yeah,
bias the same way.
yep,
We're shadow boxing.
yeah,
Providers and the patients are shadow boxing these things that we can't even see all the way. And through our own experience, our lived experience, we might be able to see it a little bit better. But like you said, if you're listening and you trust your doctor and they're like, oh, no, that's not what it is, there's a part of you that wants to be like, well, they've gone to school and they're the expert and they know. No, you're the expert in your body.
mhm,
You might be
mhm,
the expert in their practice, but they are still practicing.
yep,
You expert in your body,
yep.
like, and I'm on a tangent, but um,
No, no. That's real. And, and I think like it's important to name too that just because we go get a Black woman doctor or a Black person doctor doesn't change the fact that they were educated and trained in the systems that do not fully recognize and see our humanity, like just to like name it frankly. And so, you know, my first doctor when I lost my son, my first son, was a Black woman.
Mm,
And I remember coming to her 2 weeks after a 20-week miscarriage, like not miscarriage, a 20-week, like I'm in labor. I have to go through delivery and everything. A 20-week loss that could have been prevented.
wow.
And I'm very upset. And she says, I'm surprised you're still so upset. 2 weeks. That was the last time I saw her.
Absolutely.
I'm surprised and concerned that you're still so upset.
And there's this already this um stigma around mental health too, right?
Yep.
Like
Yep.
can't tell you that I'm upset because then you might take my baby, or then I might be crazy, or then
Right.
something wrong with me. Um, where everybody else gets to say, "Oh, I'm going to therapy, and I my medication, and da, 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 da." And it's like it's been used against us to tear our
Mm.
families apart. It's been
Yeah,
used to like us.
absolutely.
And you're to your point, I'm thinking about like, all skin folk ain't your kinfolk type of thing. But but I really like feel for Black doctors in the medical industry because they have to, I'm sure they come into this with ideas and plans and wanting to save the world, but then having to survive in such a pervasive system
Yeah. Yeah.
you whittles you away.
Yeah.
Doesn't mean that I want you to be my doctor.
Right.
I just
Right.
but I kind of understand and can see how someone that looks like me can get to the point of accepting all of these things
Yeah.
because,
Yeah.
about their clients is very sad and heartbreaking. Um, and I had a similar experience when I was pregnant with my oldest, Aiden. Um, I was, but again, I'm fat, I'm over, I'm Black, I'm single, I'm pregnant and single. So there's all these things that people can just
Mhm.
say in their mind about who I
Yeah.
am.
Yep.
And so, I was talking to my doctor and I was like, well, can I still run? I run 5Ks. I used to run 5Ks once a month. And
Oh, wow.
she was like, yeah, right, you run five. And I was just like, I'm
No,
sorry.
she didn't.
Yeah. And then she proceeded to tell me, "Well, you don't have diabetes now, but you're gonna get it." So, and I remember going to my car and just crying because I felt like my body had failed already at that point, that I was killing my baby, I was harming my baby because
Right.
looking at the number, looking at my actual test saying, "Oh, you don't have diabetes, but you're going to get it." Like,
Right.
how unfair and cruel and harmful. Um,
Right.
and I think that I'm grateful now that we are having this conversation, that young people that are thinking about the medical industry, that are in school, are seeing the stories and the news, and are going into their education with that piece, um,
Yes.
because I'm really hopeful that we're going to be able to turn the tide. Uh,
Yeah.
as much as prevalent as this conversation is now, I promise you, 9, 10 years ago, we were not having this conversation.
No, we were not. And it's wild when you say that because that's not a long time, but we were not like at all.
Right.
We were not. So you brought up the young people going into the medical field, which, thank you for, sort of mentioning them because a lot of times when we're talking about our young people, especially post COVID with all the things that they've like the ways in which they've shown up and the aftermath has shown up in them. I don't hear a lot of times us talking about like them with as much hope and expectation of them like getting something more right than than it has been. But I agree with that. I think that that's true. Those conversations are going to lead to more questioning and more challenging of like the status quo and just like what's put before you. And so I agree. How is mom cares bridging the gap?
Yes, we are doulas. We are building an army of doulas, one training at a time. Mom cares. So
And
I'll
what's a doula? Back up for us. What is a doula?
rewind it. A doula is non-medical birth support. So we're not checking the cervix. We're not doing, the blood pressure checks. We are supporting if you have questions around your planning options or around your options. If you have questions about what postpartum is going to look like, if you have questions about resources for lactation or placenta encapsulation, or, I read this thing on Google, please stay away from Google. But if I read this thing on Google, what do you think about it? Talking about pain management. I'm afraid I do have a low tolerance. What am I going to do for contractions?
Mm-hmm.
Or know, and so we help with the planning, we help with the education, and we're also a voice in the actual birthing room. So you can give all of your attention and focus on
Mm-hmm.
getting here safely, and we can say, "Oh no, doctor, she really would rather this. Can Is that
Mm-hmm.
possible?" You have to
Mm-hmm.
have that. They don't have to have that conversation. We're there as that
That's nice.
intermediary as well. But a doula is really helping with life transitions, because if you look online about Google, if you Google online about a doula, there are death doulas and babysitting doulas and sibling doulas.
Mm-hmm.
Really about helping you manage transitions in life.
Yeah.
Um,
Yeah.
so that um,
Yeah.
in mom cares, we do that in a number of ways. We have our direct service, so free doula care to our families who need it. We provide baby care essentials. We provide transportation back and forth to the hospital if you need it. We have a young mothers program. We're launching a daddy program.
Oh,
Um,
awesome.
yes. We do a lot of things direct service, but then we also have community education. So we have our workforce development program where we're bringing doulas into the community and training them,
Mm.
and want to be represented
Mm.
in their own communities and making sure they're getting reimbursed through Medicaid. And
Yes, I love it.
yeah, and then we do advocacy. We go to, we find the tables where decisions are being
Yeah.
made, be in Annapolis or elsewhere, and we make a seat. We bring our folding chair and we
Yes.
those tables as well.
Yes. Awesome. Awesome. I love it. I love it. So I always ask the women, this is a little bit of a shift. I always ask women who meet me here for these conversations to share with me their superpower. And so I want to know yours and how do you use it in mom cares?
My superpower is turning no's into yeses. When
Ooh, that's a good one.
I believe that Black women, we are problem solvers. I believe, especially Black moms, we know how to stick and move and pivot. In the pandemic, that was my favorite word. I used to laugh at. I'm like, we know how to pivot. I can pivot. But as a business owner, as a founder, especially a founder who's centering Black bodies, there's a
Hmm.
everybody's first answer is no. And so
Even
I'm
with the data being what the data is, the first answer is no.
what about the other moms? What about what why just Black moms? What about yeah, absolutely. Did you see the graph where our
Right.
number is here and everybody else's number is down here?
That
Yes.
feels like my conversations, in a much, I mean, it's an important scale as well, but in with starting the well, right? And even, continue to build and grow it and She's Well Networked is it's been less over the last couple years, but I'm telling you, when I first started 5 years ago, it was like, what about all women? Why
Right.
not all women? Or all women of color? I can like see that. Like, why just Black women?
You singing my song, Nakia. I just I I I made a very concerted effort at the beginning, because at first, when I first started, I was tiptoeing and I was saying BIPOC and
Mhm.
color. No,
Mhm.
the numbers, the data, the numbers that do not lie say that Black women, Black CK
Yeah. Yeah.
women are
And
at the high.
listen, and so that's so funny because I stood on that data day one. And I would not bend, deviate, use other words, whatever, because the numbers don't lie. The numbers say something drastically different is happening for us, to us, whatever. And
Right,
so that is why
right,
the numbers are why.
right. And so,
So give us a couple of the stats that ground you in this work. You gave us one about the outcomes for a black mother with a PhD having being more likely to die in childbirth than a white woman with a GED, or not, or doesn't even have a, I think you said with a
right,
GED. And not that it should matter what your
right,
socioeconomic status is. I know that's not the point you're making, but it does end up mattering. Like health outcomes do look different depending on what your socioeconomic status is. But for black mothers, your socioeconomic status can be here and your health outcomes are still.
right. And when you talk about, and so another statistic that we talk about as far as like the effects of constant stress, it's called weathering, right? The fact that at
Mhm,
the intersection of Black womanhood, you are always under stress. You under some misogynoir, you are under some sexism, you're under stress and under somebody's thumb almost all the time. You have to keep your head on swivel, right?
mhm,
Weathering. When people started to study birth outcomes,
mhm,
or that every other group, as they got older, their outcomes started to improve.
mhm,
You take from young mothers all the way up to older mothers, they saw that for every other group, their numbers started to improve the older they got.
mhm,
For Black women, the numbers started to depreciate the older we got,
mhm,
because
mhm.
because that much more time under stress. That's that
Mhm,
much more time being traumatized. That's that much more
mhm,
time being neglected. And so it's almost healthier to be that young mother. I'm not talking to any of my little sisters out there and tell you to go out and get pregnant. That's not what I'm saying. But the numbers are saying that based on lived experiences, everybody else, as they get older, they get more stable, they get,
yep,
have more health, better health outcomes. For Black people, it's worse because of that consistent stress that has
mhm,
happened in our body.
yeah. Weathering.
So
Wow.
that's that's unacceptable. It's unacceptable. The fact that in Baltimore City, Black babies are born smaller, earlier, and sicker. There's no like, there's no reason for that.
Yeah, because
And
there's not a lack of resources.
there's not.
There is not a lack of resources. We have access to everything.
Right.
Like,
Yeah. And so I mean, so the thing that has me quitting every day and getting up and coming back to work every day is the fact that these people look like me.
yeah,
You know,
yeah,
these are my people. These are my neighbors,
yeah,
my girlfriends,
yeah,
my
yeah.
my and I know that we have survived in this country for over 400 years at this point. This this is not going to take us out. Like there's something magic in our bones. We
Yes.
deserve to be soft. We deserve to have some joy in our pregnancy. We deserve to be be confident in our bodies, in our pregnancies, in our families. Um,
Mhm,
and again, I have Aiden, who was not supposed
mhm,
to make it through the night. They said he's not
mhm,
gonna make it through the night, and if he does, he's going to have all types of issues. That
mhm.
he stays sick, but that little boy is an astrophysicist. He's running around,
Wow.
he's living his life, and
Yes.
the promises that I made to God in that NICU,
Mhm.
that I made to my sister. And excuse me if I get emotional, but
No.
I made to my sister the last time I got to speak with her.
Mhm,
That's what like it's personal. Like you can
mhm,
throw whatever you want at me, and
mhm,
it's unfortunate because people want what they think you got, right? And so
mhm.
as much as I want to say that like everybody supports this work the same way and we're all like kumbaya, it's not always easy, and it's
Yeah.
the case. But like I got fire in my veins. Like there's nothing that
Mhm,
happen to make me stop fighting for Black families, period.
Mm,
Um,
period.
because we deserve it.
Yes, yes, I love it. So her superpower is fire in her veins. She said turning no's into yeses, but I think it's the fire in your veins that is your superpower. That's
Yeah.
giving Jean Grey Phoenix level energy. I love it. I love it.
I got my little
So
grays over there. So
yes. So how do sort of pausing on the moment because I asked you about your superpower and you said turning those into yeses, which is a huge thing in business, right? Like so this is a conversation where I'm combining like all this very big thing that we are dealing with as a country. I want to say as a community with Black women's Black maternal health, but on the business side where you talk about like turning no's into yeses and having that core that why when you talk about fire in your veins like you have like such an intense why for this work and that's what keeps you going every day
yeah,
and so I just want to name that for those of us who are listening and maybe you got on and listened because it wasn't about for you wanted to hear be inspired by a business owner or whatever and it wasn't as much about the conversation of maternal health or that's a secondary piece of it for you that whole like having a why for whatever you're doing that keeps you going when it is impossible
right,
because it is sometimes even in a space where all the numbers say everything you need them to say. Like you shouldn't have to convince anybody of anything. So for those of us who have businesses where, we're selling a product or a service that like you don't have like hundreds of years of data to support, you do. And it's still you get met with no's
right.
because
And if I could speak to that person that has logged in, that is
yep.
for that business acumen piece, you're going to get no. You have to stay. It has to be in the staying power. You get a no, you go figure it out and you prove it. You get a no or a not right. A no is a not right now until they meet you the second time or the third time
Mhm.
or the fourth
Yeah.
time. There's a tenacity in business owners, there's a tenacity in founders that says, okay, it might be no right now. Because there are people in 2017 was like, I'm good. No, no, thank you. We don't have space for it. That are calling
Mhm.
me now,
Mhm. Mhm.
now, right?
Mhm.
So there's a tenacity that you have to, and you have to wholeheartedly believe and believe in yourself. I say, and again, I'm getting a little religious, but like I say, a belief in yourself is a type of belief in God. Like you have
Mhm.
to believe blindly in
Mhm.
what you were doing, and that it's going to work out, and
Yeah.
trust. Because it does. It takes time. I think what's the statistic? Most businesses in the first 5 years fold, right?
Yep.
So
Absolutely.
times six, you might not see a return until six, seven, eight.
Yep. Yep.
But it's there. The people that don't get there, the people that stop.
Yep. Period. That is true. The, you stopped. You stopped before. You hit it. Um. So I'm gonna come back to that one, but one of our pillars in the well is collaboration. And so like this year, really excited the well is collaborating with Mom Cares. So whenever the well is hosting something this year, we are going to be collecting personal care items for babies and mamas on behalf of Mom Cares. And I'm really excited to be a part of that because it is so many of one, all of us came from a mother. All the women in the well came from a mother. Most of us, I'm gonna say, I think most of us a black mom. Oh, I know most of us a black mama, if not all of us. But also many of us are mothers, and many of the women who join the well join us in some like transitional period of motherhood. I've noticed, like whether it is she's pregnant and about to deliver. She just had a baby. The baby's just going to school, like some transitional period of motherhood. Like that time, those transitions to motherhood, like really lead us to walk through new doors. They really do. And so I'm excited for us to be able to partner, because we all are connected to a Black mother in some way, shape, or form. And it's such a, we've talked about it for a couple years where we've been like, okay, we should do a drive for this or drive. And I've sat with it because I wanted it to be so meaningfully intentional, when we did connect to something. So I'm really excited that one, you're a member and we're partnering, but two, the work that you do. So what are other ways that individuals and organizations can collaborate with mom cares?
So I just want to give a shout out to the well, because even when, especially when I have felt like I didn't belong, especially when I have felt like, why am I even here? Nakeia Drummond has always given me a smile and a warm welcome and a reminder, of why I'm here and that I'm supported and that I'm loved. And
Yes.
um, which is why the collaboration is so important to me, because the well is somewhere I feel safe no matter what.
Oh, I love it. I'm so glad.
It's
I still remember the first time I saw you in person, and I'm like, yes, you're here. I'm so happy to see you because you had just had a baby.
actually postpartum, and I was like,
Yes.
but those are the relationships and collaborations, those safe spaces, those genuine spaces that we're looking for. And so the way that you can collaborate is you can reach out to me. This is definitely the year of partnership. And so we are reaching our hand out to other folks. We are always looking for presenters. We're getting ready to change our care model, and so we're looking for people to present to our families on a regular basis and do groups. We're always looking for volunteers to help. You can sponsor a family, you can sponsor a doula. We do diaper giveaways. If you have a space or a community that you want to access our diaper giveaways, that can be a thing. The sky is really the limit. It's just
Mhm.
I want to partner with people that I am in collaboration with, that I am in concert with. People
Mhm.
are about building community and doing it
Mhm.
safely and doing it in sisterhood or brotherhood. Brotherhood is fine too, but like siblinghood, I want us to feel good about what we're doing together in the community. And I want us to be a catalyst for that. And so,
Yeah.
if you're under the sound of my voice and that sounds like your MO, it's executive director at momcares.org. Shoot me an email. But we are really looking for intentional partners to help us move this work forward. And it can look like if you're a videographer company, you want to give us some free videos, or if you want us to come and present to your people because you got moms that are pregnant on staff, or you want
Mhm.
like there's the sky is really the limit. We're just looking for other like-minded organizations that care about the well-being of their people and their community. And we can figure it out. We can figure
Yeah.
it
I love it. I love it. So, two last things. One is, since we've been talking about moms today,
out. Yes.
I want to ask, what's something motherhood has taught you that's helped you in business?
Um, my silly answer to that is dealing with poop. Having to deal with poop has taught me how to deal with poop. Um,
And that's real.
but I think motherhood really taught me about my own power and
Mhm.
my own magic. You know,
Mhm.
two little people that think I am the best thing in the world,
Mhm.
and the answer to
Mhm.
all your questions is a huge confidence boost,
It
and it keeps
is.
me on point. But they also encourage me to be soft. When I'm working
Mhm.
late
Mhm.
computer, they come up and want to cuddle, and I got
Mhm.
my phone away or my computer away. And so,
Mhm.
I think I know that motherhood has tapped me more into my own magic and my own
Mhm.
solving, and has made me softer.
Yeah.
I mean, some
Yeah.
people meet me in the boardroom might not agree, but overall,
But overall,
for sure.
no, that's beautiful. And like you said earlier, we deserve that softness, right? To live in it and to experience our own softness, to be able to peel those layers away. Um, and to just and to be able to be the most amazing, beautiful, wonderful person in the world to somebody too. Like how amazing is that? So that being said, let's end on this. How do Black moms advocate for themselves? What are things we need to be doing, asking, following up on, etc., to protect our lives and our babies and our sisters, right? Who might not know to advocate for herself or might seem off or like how do we advocate for her and to her about her?
For sure. So number one, like you kind of touched on, if you are navigating a pregnancy and you are going to the doctors or seeing a provider, people always act different when there's somebody else in the room. So if you can have somebody with you, if they can be on the phone or on video chat or whatever, people are on better behavior and kinder with their words and more intentional when you have someone with you. That's
Mm-hmm.
where doula can be in play. Asking questions, using those kind of like active listening questions. So, can you tell me more about that? You know, when people come in and I call it their hair being on fire, when their hair's on fire and you have to do it right now, just kind of being like, how much time, is this an emergency? Do we have
Mm-hmm.
to talk about it? Right. So, kind of
Mm-hmm.
asking those questions that get them to calm down. I also
Mm-hmm.
I have a background in customer service, and I did customer service through college. And so, understanding that when somebody's up here, if you come down here, they have to meet you. So,
Mm-hmm.
because I don't want to tell my sisters to be the emotional set point, we
Mhm,
if we can do enough to become the emotional set point, then people will come down to meet us. So, if somebody's up here,
mhm,
rah 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 rah, and you're like, oh really? I don't
mhm,
agree with that. Can we discuss it?
mhm,
Then they
mhm.
down. And so,
So what
um,
if we are the one that's rah, 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 rah?
and
Because
you
that's real too.
right, you write your questions down before. If you know that you're gonna get rah rah because the last time they was talking out their neck and you not about to have it, and you've been in the mirror talking about, and another thing, do all of that. Write your questions down so you can be clear headed enough to still get your questions answered. Right,
Yeah.
with someone pregame before. I can't believe this person said this, or I feel like they're going to say this the next time. Okay, let's organize what our questions are going to be. Let's organize what we need to know. Make sure that they put it in the chart. If you ask for something and they say no, if you say something is wrong and they say, "Oh, you're being crazy or you're lying or your pain tolerance isn't good enough," thank you. Please put it in the chart. Can you notate it in the
Mhm,
chart? Those words, "Can you notate it in the chart?" are magic. They change
mhm,
every response, right?
mm,
I say I need this, and they're like, "Oh no, you don't need that. This is just what happens." Okay, can you notate it that I asked for it and I didn't receive it?
mhm,
Leave that room. They're gonna come back and they're like, "Actually, we decided that."
mhm.
I think if you don't take anything from this, from my answer to this question, it would be, um, "Can you notate it in my chart?"
I love it. I love it. Thank you so much, Anna, for your time, for your work, for your energy. It's always a pleasure to talk to you. It always just feels like love. And I know that that's what the women who, and the men now who encounter you and Mom Cares, get to feel and experience, and that's what they deserve in this journey to bringing little people into the world. Thank you again for your work and thank you for bringing it all to the well. Looking forward to seeing you soon in
Yeah,
person.
yeah. We have a number of events coming up.
Oh,
Um,
great. Tell us about them.
11. So you can go to Mom Cares underscore Baltimore on Instagram or Mom Cares Baltimore on Facebook. But on Thursday night, we're having a birthing justice screening and conversation at the Patterson Park, Enoch Pratt. Then we're having an open mic night for a mom
Mm,
on the 12th at Reginald F. Lewis Museum. We've got a self care fair at the Reginald F. Lewis on the 13th. We are doing Health Awareness Day on that Sunday at New Bethlehem Baptist Church. We got a Daddy Doula launch, really quick, sorry. And then yoga is happening on the 16th. And then finally on the 17th, we're doing a legislative session at Reginald F. Lewis Museum, followed by a happy hour. So there's plenty of times to come and see
Yes,
me.
I love it.
You feel the love through this. Come and get a real hug. I'm really good with the hug. So I hope to see you.
Awesome. Thank you. Thank you so much. I hope you get all the people in the room who need to be in the room to support this really, really important work. Thank you for everything you do, Anna, and let us know how we can support you.
Yeah, thank you.
And thanks y'all for joining us, and we'll see you next time. If you don't follow us, do that. She's Well Networked on Instagram. We're also on LinkedIn as the dash well dash network, and then also on YouTube, She's Well Network. So thank you all. Talk to you soon.